Protests continue in India after the sexual assault and murder of a medical student earlier this month. Medical workers went on strike today after a week of demonstrations. Protesters say they want tougher measures to combat violence against women. That is the victim's father. His face has been blurred for their privacy. He says his daughter is gone, but the protesters are now like his children. Demonstrations across the country began last week after the 31-year-old was found dead at the medical college in Kolkata in the country's northeast. Many of those protesting say they are upset that changes to the law have not done enough to stop sexual violence in the country. Journalist Rebecca Bandhan is following the story for us, and she joins us now from Mumbai. Rebecca, tell us more about what the protesters are saying.
Yes, well, the strike that we've seen that was called today really represented an escalation of the protests that we've seen over the past few days, with the Indian Medical Association, which is India's largest doctors' body, calling for this 24-hour strike. And they said this could involve some 1 million doctors. And what we saw at hospitals in Mumbai and across India today, across many cities, was non-emergency services being actually shut down as part of this strike. And this meant that many patients were actually being turned away. It was only really emergency services like casualty departments that were still operating, whereas things like elective surgeries, for example, routine treatments were not necessarily available at many hospitals because of this strike. And that just goes to show the level of support for this cause, the anger that's gone into this following the rape and murder which took place last week of a 31-year-old trainee doctor at a hospital in Kolkata. This is not showing any signs of easing as people are raising their voices about their concerns about women's safety in the country, and doctors are raising concerns about their safety. They're making these demands. They want to see a federal law for medical professionals that actually protects them from violence. They're saying that security at hospitals should be no less than what you'd see at an airport, for example. And they're also demanding justice for that victim.
So what's been the impact of these protests?
Well, certainly we've seen with the doctor strike today, for example, there has been a massive impact on medical services. And that's actually really forcing the government to sit up and pay attention. We did see those medical associations actually meeting the government, the health ministry, today in New Delhi, and they gave them their list of demands. And the government, in a statement, said that it was looking at these, and it gave assurances that it would actually make all efforts to ensure the safety of doctors in the country. And it also said it will set up a committee as well, but it also urged doctors to return to work, saying that that was in the public interest. But the question here is, even if doctors are happy then with what the government has said, the bigger issue is that this is an issue about women's safety in India as well, and many people are just not happy with the lack of progress that's been made over the years. Following that, if we go back to 2012, when there was the brutal gang rape of a woman in a bus, and that resulted in her death. After that, laws were tightened in India, including up to the death penalty for repeat offenders when it comes to rape. However, with the Kolkata case that emerged last week, we're still seeing that there's a massive problem when it comes to women's safety in India, and we're seeing these protests spreading to women's rights groups, to the public. So these voices are going to keep raising their concerns as this continues to be a massive issue in India.
Rebecca Bandhan in Mumbai, thank you.